Yes, so Daniel Heinisch, my name. I'm the CEO and founder of Recog Analytics. We are a startup and we build technology for more human-centric medicine. That's our goal. Okay. Where did we come from? We started noticing that there was a double or even triple problem. There was a lot of talk today about the sustainability of the healthcare sector, the aging population, of course, and clinicians don't having enough time. We know that, and it's one of the key reasons why we developed Relisten. But there is an even more important one. And it is that here in Spain, maybe in Finland it's probably different, but when you go to the doctor has to do two things, basically. He talks to you to figure out what is happening, what's going on with you, he needs to do the physical exploration, etc. And he needs to take notes during the interaction. How does that end up? Well, it's really not a close conversation between a patient and a doctor. It's more of this face that comes out from behind the computer screen, asks you, do you have any allergies? Yes, I am allergic to this. Okay, let me just write that down for a minute. Bop, bop, bop. And that's how it works right now. So we notice that there is this triple problem about patients feeling left alone during their doctor consultations, and the two we already mentioned. So a lot of missing doctors, which is estimated to be about 10,000 in only 5 years' time that we would need for an ideal healthcare here in Spain. And also the time that doctors consume taking notes, it's in reality around 1.5 hours every single day. And as we tell the doctors, you haven't studied to take notes. That's why we decided to develop Relisten. It's our AI-based solution that allows us to go from that status quo that is constantly interrupted during the consultation to the one in the bottom, where it's just a natural conversation without any scripts. There can be multiple people involved, so the family of the patient can be there, the nurse can be there. It takes all of that conversation, and then it transcribes it, it structures it into the different parts of the clinical notes that the doctor usually fills out by hand, and it writes the notes as if it were the doctor, with the medical terminology, splitting it correctly, etc., etc. That way, we not only make the patient more satisfied, and it's also a very big psychological benefit, because when the patient feel like the doctor is not there for them, they also trust the doctor less. This also influence adherence on the treatment, which is, as was previously mentioned, extremely important. So there are a lot of benefits of having the doctor already spend that quality time with you. But not only that, we also save time from every visit that can be used to take on more patients or to spend more quality times with the patient we have, so we can explain further how should the treatment be done, etc., etc. Now, our solution, of course, the topic that everyone's thinking about, data protection, security, vital topic here. We are as well ISO certified for security. We don't save any data, we just process the conversation. It's sent anonymously. We follow all the security standards. It's processed and then sent back to the EHR. So you can imagine ourselves as being a very easy to use plugin for the system that the doctor already uses. That was really important, because if we make it complicated, no one will use it. How does the doctor use it? At the beginning of the conversation, they have a new button in their system, start consultation. At the end, finish consultation. That's it. And for them, it seems like an autofill function of the notes that they would usually take on their shelves. Then they just need to review them. Of course, important, always double check the AI, not perfect. So you need to make sure that what's written there is okay, but you can still save a lot of time and provide better care for your patients, which is our objective. Now, where are we as a company? We started developing the solution a bit over a year ago, and we first released it to some friend of ours who work in medicine, to doctors, who started testing it around April and May. Then we went already to hospitals, and we've already achieved to close over half a dozen POCs with very big relevant private as well hospital groups, as well as with the public healthcare system. Those POCs are taking place as we speak, and we're in the process of closing several additional ones. We're talking to a lot of collaborators about how to get the solution also distributed possibly in Latin America. We are multi-language, no Finnish yet, but as he said, yes, why not? So we can do it. And but also to get it integrated into a public healthcare system. We are talking to the big players here who work already with the public healthcare system to go in a partnership to license it to them. And that's big for us. We're also part of different associations like BioSpain. We participated as well in the program that you mentioned in the Health Start Madrid. We're participating there as well. And while we're here, we're looking for all sorts of networking. So first of all, as I was saying, collaborators, additional technology companies, even companies from Finland who would be interested in this technology. I think there are some where we have a technological fit. We are looking for private, public hospitals or healthcare centers, clinics who want to try the solution. Really easy to try. We've developed a website, so we just give you an access user. You can talk between two doctors to simulate it. Then you see how it goes, super easy. And finally, we're also doing a financing round in a couple of months, not yet live, but well, if there are investors who are interested, of course, happy to talk as well. Thank you.